Hi everyone, my name is Nelly Faghani and I'm a physiotherapist, and I'm here today to talk to you about pelvic health or pelvic floor physiotherapy and its benefits. I have a disclosure. This presentation is not meant for medical advice, so please speak to your primary care practitioner or physiotherapist for individualized assessment and treatment options. So what is pelvic floor or pelvic health physiotherapy? Well, it's evidence-based treatment of pelvic floor dysfunction. So that's anything from pelvic pain, urinary or fecal incontinence, pelvic organ prolapse, seeing a physiotherapist pre or post-surgical, or treatment for bowel dysfunction. So physiotherapists get advanced postgraduate training to do internal evaluation, whether it's vaginal and or rectal. And not every physiotherapist has these skills. So if you're interested in pelvic floor physiotherapy or pelvic health physiotherapy, you need to seek out someone who has this training. So what are the pelvic floor muscles? Well, they're a group of muscles. There's actually 3 different layers, and I have a model here for you. And these muscles silently do their job without us much thinking about them. A lot of people don't even know that where these muscles are, or many people don't do anything to ensure their good health. It's very different when you see a muscle on the outside, say your bicep, and you go to the gym and you exercise your bicep and you see it. These muscles are internal. Well, actually, there are 3 different layers. So they start from the outside and they go inside. But many of us don't do anything for them. They have various functions. They have a supportive function, so they hold all our organs inside. They also have a sphincteric function, and that's because they go around the opening of your urethra, where the urine comes out, around your vagina and your anus, so they help keep you continent. They also need to relax in order for you to be able to urinate or defecate. They also have a stability function and a sexual function. So as you can see on my model, the muscles start from the front at the pubic bone and they go all the way back to the tailbone and they go side to side. So they form this bowl-shaped structure at the bottom of our pelvis. And on here, you could see they start from the pubic bone at the front and they go all the way back to the tailbone. So on this diagram, right behind the pubic bone is the bladder, and behind that is the uterus, and then behind that is the rectum. So these muscles in that supportive role hold everything in place. In the sphincteric role, they go around, as I mentioned, the urethra where the urine comes out, the vagina, and the anus. So what symptoms can be treated by a pelvic floor physiotherapist? Well, if you're experiencing any abdominal pain, low back pain, pelvic pain, sexual dysfunction, even dyspareunia specifically, so that just means painful intercourse, or we have clients that we see that can't even have any penetration. Even urinary symptoms such as urgency or frequency, any type of incontinence, whether it's urinary or fecal, and for pelvic organ prolapse. Now, for chronic pelvic pain and for clients who have endometriosis, pelvic pain is one of the main symptoms that they may experience. Physiotherapists play a very important role to help treat the myofascial dysfunction that can be contributing to the chronic pelvic pain. So we are really playing one part of a multidisciplinary team. And we really want to have a biopsychosocial approach, which means that we are looking at the bio piece, the tissue, but we need to look at that psychosocial pieces that can contribute to more of the symptoms that you experience. And as you can see in this study that was done in 2011, it was shown that physiotherapy is an integral part of that interdisciplinary team that must take this comprehensive framework with this biopsychosocial approach that I mentioned when treating pelvic pain or dysfunction. So what can you expect if you went to go see a pelvic health physiotherapist? Well, we would start off with a very thorough subjective evaluation. You might be asked to fill out a variety of forms. We want to listen to your story. So everything from your past medical history, what practitioners you've seen, if you've had any surgeries, and what the outcomes of those surgeries were. And we do ask a lot of questions regarding your symptoms around bladder, bowel, sexual, or pelvic pain. So, or any pain for that matter. So we might ask questions like how often you go to the bathroom, do you have any urinary leakage, how often do you have a bowel movement, has your sexual function been compromised, and we would ask where your pain is. We would ask descriptions of your pain, what makes your pain better and what makes it worse. We also may administer a variety of different outcome measures. So these are forms that you would fill out that have been validated in the research that shows us that what your symptoms are like, and we would re-administer those outcome measures to monitor progress. Now, these could be anything, again, as I mentioned, around bladder, bowel, or sexual dysfunction, but we also would ask questions regarding symptoms of depression, anxiety, stress, or the way that you're thinking about things. In the research, there's a questionnaire called Pain Catastrophization Scale, and the research has shown that symptoms of depression, anxiety, or stress, or catastrophization can turn that volume of pain up. And that's what we really mean by taking a very thorough biopsychosocial approach. We hope that at the end of the assessment, when you see how thorough it is, you leave with some hope of knowing that physiotherapy can be an integral part of your treatment to help with your symptoms. And we really try to provide that self-efficacy so that you play a role in your recovery. We also do a very thorough objective evaluation. So I'm going to go through each of these boxes briefly. We look at the global contributors. So that's like looking at the movement of your other joints and your global muscles, even how you're sitting and how you're walking and how you're moving and what your muscle balances are like. We look at your posture and your breathing. I'm going to talk a little bit more about that in the next couple of slides. We look at connective tissue. Again, based on the research, we know that if you have connective tissue restriction, that may be contributing to your symptoms. And connective tissue is everything above the muscle but under the skin. So you might find your therapist rolling your tissue, maybe looking specifically around some scar sites, and that doesn't have to be a big scar. It could even be from a laparoscopic surgery. And of course, we look at the central nervous system, which I will talk about a little bit more. And as I mentioned, physiotherapists can have advanced training to specifically assess your pelvic floor. So with respect to posture, there is no perfect posture, but we know that certain postures can contribute to more tension of the pelvic floor. So we would look at you from different angles, and that gives us a little bit of insight of what your muscle balances are like. And we would ask if there's certain postures or positions that increase your symptoms. And the notion of motion is lotion. We know that movement is so good for you. And of course, based on what we see objectively, we may prescribe some global exercises or movements, whether it's in the form of stretching, movement stretching, what we call dynamic stretches, or things like walking. But all of these are going to be very individualized to what you present to us, and that exercise program or those recommendations around maybe changing your posture a little bit are specific to what we find during the assessment. Now, we also look at breathing very closely. Now, the breathing diaphragm and the pelvic floor are very linked together. So when you take a deep breath in, your diaphragm comes down and your pelvic floor relaxes. And when you breathe out, they go back up. So you see there's a very close connection between the two. So by improving your breathing or changing your breathing, we can change what's happening with the pelvic floor. Not to mention that breathing, soft, relaxed breathing is the fastest way into the autonomic nervous system. And what I mean by that is, if you imagine if, I don't know, a lion was to come in the room, that would be really scary, and I would have certain physiological responses to that. I would certainly breathe different. I'd be like, right, that fight or flight stress system kicks in. And so you could see if I'm breathing really shallow, the pelvic floor is not moving very well. So if I do some slow, relaxed breathing, right, we can facilitate that relaxed system versus the stress system. And so by changing our breathing, we're able to change a lot of things. So again, if that lion was to come in the room and I'm like breathing really heavy, my heart rate goes up, my blood pressure goes up, even my muscle tension would increase. When that sympathetic or that stress system is dominant, we feel more pain. So changing our breathing can actually help change pain, not to mention that it can decrease muscle tension, which may be also contributing to your pain. Now, when we assess the pelvic floor, we assess what the state of the pelvic floor is. So we're really checking to see if the muscle feels underactive or overactive. So much like if I was to touch this part of my hand right here, that's what I would like a muscle to feel like. If I was to pinch between my index finger and thumb and pinch really hard, if I touch that area now, that feels harder. That's what we would feel when the muscle is overactive. And if it's really, if you even look at it and compare it to steak, a raw steak would be underactive and one that's well done would be overactive. Typically, even though not always, when we see muscles that are underactive, our clients are presenting with various types of incontinence, whether it's urinary or fecal, or they may feel pelvic organ prolapse when the muscles are not supporting our organs as well. So clients would be feeling more pelvic pressure or like something is coming out of their vagina. In this case, these muscles are often thinner and weaker, and we would prescribe pelvic floor strengthening. So these are called Kegels. You may have heard of Kegels before. And with the idea and notion of exercising to fatigue to be able to hypertrophy or thicken the muscle, like me going to the gym again and doing bicep curls, if I was to do it regularly and fatigue the muscle, my muscle would get bigger or hypertrophy, and that's what we would do for muscles that are underactive. Now, a lot of our clients that present with pelvic pain or urinary frequency and urgency, which are symptoms of overactive bladder, or dyspareunia, which is pain with intercourse, or constipation, our clients have overactive muscles. So these muscles feel tighter and they may even be tender to touch. In cases that the muscles are tighter or shorter, we would not prescribe Kegels or pelvic floor strengthening. We would do the exact opposite. We would do lengthening of the muscles. So we would give verbal instruction, which we can confirm that you're doing properly to help relax or lengthen the muscle. Now, overactive pelvic floor muscles have been defined as a condition in which the pelvic floor muscles do not relax or may even contract when relaxation is functionally needed. For example, when you want to go to the bathroom to urinate or defecate. So they need to relax and open the openings. Remember, I said they go around where the urine comes out and where the stool comes out. They need to be able to relax in order for you to be able to urinate or defecate. Other things that can contribute to more tension of the pelvic floor are fear, like that lion coming in the room, anxiety, or even stress. So here's some more pictures of the pelvic floor muscles. This is the deepest layer, the third layer of the pelvic floor that you can see. And the muscles start from the front, that's where the pubic bone would be, and they go all the way back to the tailbone and all the way back to the pubic bone again. So, and they go side to side, like I mentioned. And if you have tension in these muscles, as you can see in the picture on the right, they may refer pain to different areas. Much like if I had tension in my neck and shoulders, if I was to touch them, they would feel tighter, harder, and possibly they would refer a headache. Now, not everyone that has muscles that are tender, it's going to refer, but that is something that we feel when we're doing our internal palpation, touching the muscles inside to see if they recreate the symptoms that you're experiencing. Now, dyspareunia, as I mentioned, is painful intercourse, is actually very common. A lot of people are not talking about it, but it is 2 out of 3 women at one point in their lives can be experiencing pain with intercourse. And there's lots of different causes, and I've mentioned a few, with the top one being overactive or tight pelvic floor muscles. And because these muscles go around the vagina, they can tighten and not allow for accommodation. Other things that can contribute to pain with intercourse include poor lubrication or even fear. I'm going to draw us back to the example of the line coming in the room. The physiological response is my muscles tense up when I see that line, especially in the pelvic floor. There's lots of research that say those are actually the first group of muscles that tense up when we're scared. So if we've had an experience where it's been painful to have intercourse, or the attempt of having intercourse, or even putting something inside, you could see consciously, subconsciously, that the pelvic floor muscles would tense up. So what can we do about it? Well, there is research that shows that multimodal physiotherapy, so using some of our different techniques, and this multidisciplinary approach are very effective in decreasing pain during intercourse and improving sexual function. Now, this overactivity of the pelvic floor is not simply an isolated dysfunction, but could be a physical manifestation of the patient's emotional state. And that's what I was talking about, fear or anxiety. So in cases of actual or imminent physical or mental pain or anxiety, the pelvic floor muscles will involuntarily and often unconsciously contract. It's there to protect you, right? If that activity hurts, the muscles are going to tense up. And there is, based on the consensus guidelines for the management of chronic pelvic pain, physiotherapists are an important part of the health team in relation to chronic pelvic pain because of this myofascial dysfunction. So this is definitely something that pelvic health physiotherapists can assess and help with. Pain education is also really quite important. Now, the newest definition of pain in 2020, based on the International Association for the Study of Pain, is that pain is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. So I just want to draw some attention to the fact that it is a sensory and emotional experience. And even if it's actual damage or potential damage, that volume of pain can go up. And thoughts or nerve impulses and even negative thinking can increase that volume of pain. There is compelling evidence that pain education can reduce pain, disability, catastrophization, and help with physical performance. So we do a ton of education as physiotherapists. One of the pieces of education that we do is on vulvar care. Now, we need to make sure that you don't wash your vulva. So the vulva is on the outside. So this is the vulva. The inside is the vagina. The two terms are often interchanged, but do not wash your vulva with anything but water. Okay, when you're going to have a wipe after urinating, you need to wipe front to back. Ideally, use organic or fragrance-free detergents, and cotton underwear and feminine hygiene products, cotton ones, are best. If you're experiencing urinary leakage and you need to wear a pad, make sure you're buying the pads that are from the different aisle in the pharmacy. So not the ones that are for your menstrual period, but a different aisle for urinary incontinence. And that will wick away the urine from your skin a lot better. Always pads are notorious for being a bit irritating. I've heard that at numerous conferences. And sleeping possibly without underwear can be helpful, removing wet clothing immediately. And hydration is important for so many aspects of our life, including good vulvar health. So how many times is it normal to urinate in the day? Well, normal voiding or urinating during the day, assuming a normal fluid intake, is about 5 to 8 times a day. So if you're urinating a lot more than that, then that's urinary frequency. You should be able to also delay losing urine to get to the bathroom. So you should not have leakage before you get to the bathroom, like gotta go, but you don't get there. You should not be straining to urinate, and there should be no pain with urination. To ensure good bladder health, you should be drinking sufficient water. We don't know what the right amount of water to drink is. It really depends on your weight, the weather, how hot it is, how much activity you've had, but you should be drinking enough so that your urine color is a pale yellow, like the picture on your left, number 1, 2, or 3. If your urine color is dark or feels hot and burning when it's coming out, you definitely need to speak to your primary healthcare practitioner. But I would recommend that you sip water more throughout the day. And if you're getting up at night to go urinate, oftentimes it's because you're drinking too late. So maybe stopping your fluid intake 2 to 3 hours before bed would be helpful. Now, there are certain things that are going to make you urinate more frequently, and top of those lists are caffeine, alcohol, spicy food, citrus fruits and juices, even carbonated beverages, and artificial sweeteners. So the triple whammy on this, on the pictures here, is Diet Coke, because it's caffeinated, it's carbonated, and it also has artificial sweetener. So if you're peeing a lot, maybe avoid the Diet Coke. Now, constipation is something that we see very frequently within our clients, and we need to address that because if you're straining to have a bowel movement, what ends up happening is you can get little microfiber tears within the muscle, which heal really quickly, but could cause them to heal in a little bit more shortened position. So we want to make sure we address constipation. Now, normal bowel function has quite a range. You could have 3 bowel movements a day, it's normal. You can have 1 every 3 days, it's normal. But what we want is for it to look like the picture on your right side, type 4. That's the Bristol stool chart. And type 4 is when your stool is soft and smooth. You should not have any pain with a bowel movement. You shouldn't be straining to have a bowel movement. So the ways that we can ensure good bowel function is drinking sufficiently, exercise and movement, sufficient fiber, so a combination of soluble and insoluble fiber, and never ignoring the urge to have a bowel movement. Because if you ignore the urge to have a bowel movement, that urge goes away and the stool sits there and loses hydration and will get more hard, where you would get more like the type 1 to 3 on the Bristol stool chart, which is considered constipation. Other things that you could do is putting a step stool in your bathroom so that your knees are above your hips. When you do that, the angle, as you can see on this bottom right picture, the angle changes from being this curved angle to a straight angle, right? This is showing it in a squatting, but you're kind of mimicking squatting when you have your feet on a step stool. So you can have your bowel movements come out straight instead of having to go around this angle. Another thing that you can try is sort of reaching over your right shoulder, and that's because the way that the colon goes, it goes up, across, and down on the left side. So when you're twisting over your right shoulder, it's almost like wringing that descending colon a little bit to help things pass. You can tilt your pelvis around, and one really good thing to try is if you feel that it's there but it's not coming out, instead of straining, blow really hard into a closed fist. So you can make a closed fist, maybe with a little bit of a hole, and then blow really hard. You can even try making noises like shh or right? Keeps the back of your throat open, and the pelvic floor will help relax at the same time. Now, something that you may have not known about, but physiotherapists also offer virtual treatment. There's a lot of benefits, especially in times that you can't go into the offices to get a consultation. It's really easy and convenient. If you have a computer with a camera, that would be ideal, and it will prevent interruption of care or can get you started if the offices are not open or if you live in a remote area and can't get to a physiotherapist. And it is covered by many extended healthcare providers. So it would say on your receipt, it's a virtual physiotherapy treatment. I would encourage you to call your provider to see if that's covered. Now, there are some limitations. If you don't have the required technology, we could do a phone conversation too, but it really would be ideal to have a camera so we could see, get you to step away from the screen so we could assess your posture and movement. We could do a ton of the education, some which I've already discussed. Unfortunately, we won't be able to touch the muscle or be able to do a hands-on physical assessment or treatment, but I've done virtual care for some time, and I assure you that it is really beneficial and you can still get a lot out of it if you can't get into the office. And there's many physiotherapists across Canada that offer virtual care. So what can you expect if you went for assessment by a physiotherapist that has these advanced training to treat pelvic floor function? You'd be taught a lot of stuff to be able to do for yourself, to be able to help with your symptoms. It would be one-on-one with a physiotherapist, as I mentioned, that has this training. We would take this very thorough biopsychosocial approach. We would offer a ton of education, and I've mentioned some things like Vulvar Care, diet modification, pain education, but we talk about things like sleep and meditation and cognitive behavioral therapy and mindfulness that all have very strong research and support to say that it can help with many of the symptoms that we've discussed. We can help improve bowel and bladder routine and symptoms, and do some hands-on manual therapy to address some of the things like the overactivity of the pelvic floor or muscle imbalances. And of course, we love to give exercises, and based on what our findings are, we may be down training the pelvic floor to help with lengthening of the muscle and decreasing the tension if that is contributing to your symptoms. It would be, like I mentioned, individualized, and the assessment will help us build a treatment plan that would be individualized for our findings. Physiotherapy is covered by many extended health care plans. So call your extended health provider and see if physiotherapy is something that is there for you. It's a great option. Even if you were to come in just for some education to find out where your baseline is and be taught whether you need to strengthen or lengthen, and the tons of the education that I've already provided, but making it individualized for you. So if you're intrigued, how you can, refer yourself is through the Canadian Physiotherapy Association. They have a great website, which there are by province lists of physiotherapists that you can find. Make sure you find one that has training in treating pelvic floor dysfunction. I have a teaching website called Pelvic Health Solutions, which also has a listing of physiotherapists with this training. Thank you so much for your time, and I hope you're intrigued to see if pelvic health physiotherapy would be good and helpful for you.